Good morning, everyone. We'll start today's COVID-19 press briefing with Mayor John Cooper, followed by Dr. Alex Jahangir, Chair of the Metro Board of Health and the Metro Coronavirus Task Force. This morning, we are also joined by Dr. James Hildreth, President and CEO of Meharry Medical College, and Leslie Waller, an epidemiologist with the Metro Public Health Department. Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell, Director of the Metro Public Health Department, are with us to help answer your questions. We will now begin with Mayor John Cooper.
Good morning, Nashville. Now, I want to start this morning by reminding everyone that the Community Resource Center has already started mobilizing donations of important items, including personal hygiene products, baby products, and cleaning supplies to the Chattanooga area, which was devastated by a powerful EF3 tornado on Sunday evening. Anyone who can contribute at this time should visit the Community Resource Center's website at crcnashville.org to find a list of products needed to support our neighbors in Hamilton County and the surrounding area. Our thoughts remain with all Chattanoogans as they continue their recovery process and begin rebuilding their community, process that Nashville went through just a few weeks ago. Now, I'm pleased to report that the I Believe in Nashville team donated 24,000 I Believe in Hope face masks to support our community's COVID-19 response, 4,000 of which were provided to Metro Nashville's essential workforce. Today, the I Believe in Nashville team have made these washable and reusable face masks available for purchase, with part of the proceeds going to support local nonprofit organizations that are supporting Nashvillians during this time. Visit I Believe in Nashville or Nashville TN on Instagram or NashvilleTNstore.com to make your purchase today and also support COVID-19 related charitable organizations. I'm grateful to Rich Egan, Tim Gerst, Brian Cronin, and Matt Wilson of the I Believe in Nashville team for both their past and ongoing contributions to our community, which includes a donation of more than $500,000 to the Community Foundation of Middle Tennessee, and The Store, a free grocery store founded by Brad and Kimberly Williams Paisley following the March 3rd tornado. Our hearts go out to everyone who has fallen ill with the coronavirus, and we extend our condolences to the family and friends of those who have died. Now, I'm grateful to everyone here in Davidson County for continuing to follow the Safer at Home order. Your efforts are flattening the curve, and I urge everyone to stay the course. Continue remaining at home whenever possible and wear face coverings when social distancing measures are difficult to maintain as you run essential errands. Now, this morning, I'd like to welcome Leslie Waller, an epidemiologist with the Metro Public Health Department, who is here with us to talk about contact tracing, which is the investigative process of identifying individuals with confirmed cases of COVID-19 and then determining who that individual recently interacted with in order to protect both individuals and the public health. Contact tracing is one of the most important tools we have in Davidson County to mitigate the spread of the coronavirus. And many of you may have questions about how it works or even why we do it. We learn from contact tracing where we can improve our social distancing protocols. Contact tracing slows the spread of the virus by preventing a single case from becoming a cluster of cases. Effective contact tracing is essential to getting us back to work sooner. Now, Leslie is here to give an update on the Public Health Department's contact tracing efforts to date, how this department is scaling up their capabilities in this area, and how effective contact tracing will help us in our efforts to reopen and restart Nashville's economy. Now, I'm also grateful, as always, to Dr. James Hildreth, President and CEO of Meharry Medical College, for joining us again this morning to provide his wisdom and insight as an infectious disease expert into the coronavirus outbreak and our response, both as individuals and as a community. I continue to urge everyone to visit covid19.nashville.gov to contribute as you are able, to the COVID-19 Response Fund, which has been created to help Nashvillians facing hardships during this time. You can also visit the website to learn how to obtain direct financial, food, mental health, and social service assistance. And I'll turn it over now to Dr. Alex Jahangir, Chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning, Nashville. Here's the latest information we have on COVID-19 in our city. We now have 1,492 confirmed cases in Davidson County, an increase of 35 over the past 24 hours. There is an additional 1,497 cases in our surrounding counties, making our total nearly 3,000 for Middle Tennessee. Of the Davidson County cases, 1,151 are active cases, and 324 residents have fully recovered from the virus and have been cleared. We also, unfortunately, had an additional death of coronavirus yesterday. It was an 81-year-old gentleman with underlying medical conditions. My sincerest condolences to his family and friends. This now marks the 17th death linked to COVID in our county, in our residents. This morning, the 3 community assessment centers opened and will be assessing people until 3 p.m. They are located at Nissan Stadium, at the Kmart, old Kmart on Antioch Pike, off Murfreesboro Pike in Antioch, as well as at Meharry Medical College. These centers are for Nashville residents at no cost. Residents can drive or walk up to the sites and be assessed and, if needed, tested for COVID, again at no charge. Since opening on March 31st, 2,076 Nashvillians have been assessed and 1,383 have been tested. If you think you have the virus, please seek medical attention. It has spread around our world, our country, our state, and our city. COVID-19 affects everyone, whether you're male or female, no matter your situation, no matter your race and ethnicity. No one is immune. So, make sure you get the help that you need, and we're here to help. That's one reason Mayor Cooper started the Metro Coronavirus Task Force in the first place. And it's one reason why we've set up our community assessment system for Nashvillians. To have medical professionals ready to answer your questions, assess your symptoms, and if necessary, provide the test. Remember, the first step is to call our assessment hotline at 862-7777. Again, 615-862-7777. We're open 7 days a week from 7 a.m. to 7 p.m. You can speak with a medical professional who will answer your questions and determine whether or not you need further assessment. This morning, I also want to talk to you about another symptom linked to the coronavirus. While over 90% of patients infected present with fever, cough, and shortness of breath, more and more we're seeing other symptoms related as initial signs of this virus. These symptoms include new unexplained loss of smell, which I mentioned to you on Monday, as well as unexplained diarrhea. From the start, we said that we're going to let the science guide our decisions. And so based on this new information, we are including new onset of unexplained diarrhea as a 5th symptom we're looking for to determine whether you need a test or not. So if you have cough, fever, shortness of breath, new onset of unexplained loss of smell, or new onset of unexplained diarrhea, please seek medical attention either through your healthcare provider or call our community assessment system and centers. Finally, please continue to fight this virus by staying at home. Only go out if it's necessary. If you have to go out, please practice social distancing, stay 6 feet from one another, and wear a face covering. If you feel sick or think you have the virus, please seek medical attention and also stay at home. We need to stay the course and remain vigilant. Please spread the word, not the virus. We are Nashville, and we'll continue together to get through this. I'm now proud to introduce Dr. Hildreth, President and CEO of Meharry Medical College. Thank you.
Good morning, Nashville. Recently, there's been a lot of attention given to COVID-19 antibody testing as being important in getting back to a new normal. There are a few things I'd like to share with you which are really important if we're going to make decisions based on using antibody tests. When we're infected with viruses, our immune system mobilizes to eliminate the viruses from our system. And there are 2 major strategies the immune system uses to accomplish this. One of these involves cells called B cells, and they make proteins called antibodies, and these antibodies can do two very important things. They latch onto the surface of the viruses and tag them for disposal, and they're kind of like garbage collector cells called macrophages that come along. Anything with that tag gets ingested and destroyed. So that's one way the virus can be eliminated. The second way is sometimes these antibodies cover up the attachment proteins of viruses, and by doing that, they keep the virus from going into cells. They can neutralize or block the infection. The other strategy that the immune system uses is equally important because it eliminates the virus factories. When cells become infected by viruses, they can make tens of thousands, if not millions, of copies of that same virus, and they are in essence a virus factory. There's another cell type in our body called killer T cells, and they roam the body scanning the surfaces of cells, and if they encounter a cell that's infected, they actually inject that cell with some poisons to kill that cell. So by doing these two strategies, the immune system accomplishes two things. It eliminates the existing viruses and destroys the cells that are making new viruses, and by doing so, the virus infection is cleared. Now, it turns out that antibodies can have a very long half-life, as long as 3 weeks, and sometimes longer. So in a lot of folks, after the virus has been cleared, the antibodies can remain, and that's a way to test for infection. We can also measure the killer T cells, but that's much more expensive and much more complicated. So as a routine way of looking for infection, antibody tests are used because they're simple, inexpensive, and take a small amount of blood. And that is the purpose of the finger prick. That small amount of blood that you get in the finger prick is enough to do the antibody test. But some people are equating the presence of antibodies with being immune to the virus, and that would be a terrible mistake. We only need to look to another pandemic virus that we're still dealing with, HIV, for an example. Everyone infected by HIV makes an antibody response, but very few of those antibodies in very few individuals can actually neutralize the virus. There are other viruses, for example, where you don't want to have antibodies, like dengue virus. Antibodies against dengue virus can actually promote infection, not block it. So it would be a huge mistake for us to assume that the presence of antibodies can be equated with immunity. That's going to require some research and some science, and thankfully that's already happening. At Vanderbilt, at Harvard, Johns Hopkins, many other places, they are transfusing plasma from individuals who've cleared the virus with the hopes that there'll be antibodies present that can help fight off the virus. But until and unless we have definitive proof that those antibodies are protecting from the virus, we should not equate the presence of antibodies with immunity. That would be a terrible mistake. So the science is moving forward, and as Dr. Jahangir said, we need to let the science inform our decisions. And one thing we must do is establish firmly by experimentation that antibodies are equivalent to immunity, because making decisions based on that assumption would be a terrible mistake. The last thing I want to say is that those of you who are wearing face coverings, it's a really good thing, but I need to have you remember two things. Before you put them on, wash your hands. When you take them off, wash your hands. And whatever you do, do not flip the sides, because if you've been wearing the face covering and it's protected you from virus and you flip it, you're in fact exposing yourself to the virus you protected yourself from. Wash your hands before you put them on, wash your hands after you take them off, and keep the side out, and now turn it to your face. We got this, Nashville. We're going to beat this virus, and please don't be a vector. Now I'd like to introduce Dr. Michael Caldwell, who's the director of the Metro Public Health Department.
Thank you, Dr. Hildreth, and good morning. As the director of the Nashville Department of Public Health, I'm grateful to lead an organization of over 560 talented individuals who work every day for you to assure that Nashville is safe and healthy. Today, I introduce you to one of our key leaders, Ms. Leslie Waller, who received her master's in public health from Emory University. She is our Nashville Public Health Department's lead epidemiologist and has the responsibility for our COVID outbreak investigation and contact tracing activities. I remember and I thank all the members of our public health workforce, exemplified by Ms. Waller.
Good morning. I want to talk briefly today about the bulk of the work that the health department is doing right now to control the spread of COVID in our communities. We use a tried and true public health tool, something called contact tracing. Contact investigations have been around a long time. They're a core public health function that provide the foundation for many disease outbreak responses, including more familiar infections like tuberculosis, syphilis, or hepatitis. They are a first-line defense in controlling the spread of disease, especially in the response to COVID-19, where there's an absence of a vaccine or treatment at this point. So what does this process actually look like? We receive reports of all positive cases, and then we collect information from these cases, including the contact investigation piece. We first ask some questions to identify when a case was contagious, and then we get into the details of who they interacted with during this infectious period. We ask things like who a case lives with, who they might have gone to dinner with, any travel that took place and with whom. We also ask whether or not they go to work or school, and then what their office environment looks like. Is it a closed office or a cube? We explore the minute details of who the case interacted with during their infectious period, and our specific definition for COVID is being within 6 feet of someone for longer than 10 minutes during this infectious period. Once we've identified these close contacts, our team calls and confidentially notifies them of their exposure, and we explain the legal requirement to quarantine, plus how many days a contact must do so. The logic behind this is that if we can identify all the people who have a relevant exposure to an infectious case, we can then move quickly to contact them and isolate them in order to prevent further spread of the virus. Without this high level of communication with our cases, though, we do not end COVID in Nashville. Our recent cases have had exposures on the job and in the household, about 15% of them on the job and about 35% in the household. Additionally, about 15% are linked to a local cluster that we've identified within this larger pandemic. Our contacts reflect this too. About 54% of them are household contacts to a confirmed case. And these folks are at very high risk of contracting the virus, just given the environment. There's another 34% of our contacts who are either from a social, communal, or work setting. Hospitals and private business partners are also equally important in this response, as they are integral to identifying exposed personnel and patients, and we work with them to do so. So, what's next for our city, and how do we mitigate the spread of COVID as we move towards reopening? Well, as the number of cases has increased, we have grown our team internally from a humble 4 to more than 40. And that's something that we're continuously improving, and we're aiming to continue growing. We need the public to also understand the role they will play in their own health, but also that of their neighbors. By this, I mean we need you to participate in contact tracing investigations if we call you or visit your home, because you are as much a part of this response as our health department staff. Without your active participation, the city will not be able to end COVID. We need businesses to have plans in place that allow them to quickly share necessary information with health department investigators. They should also consider a work exposure as not an if, but a when, and plan for that. Plans should include notifying the health department, and someone will get you in touch with our investigation team. All of these actions help us to quickly isolate those people who are potentially infectious, thus limiting the number of people to whom they eventually will spread the virus. We ask that you consider your contacts and know your exposures as a new way of civic engagement in these strange times. And if you're impacted, please fully participate with our investigators and our staff. Thank you.
Thank you, Ms. Waller. Thank you, Dr. Hildreth. We will now start the Q&A portion of today's briefing. I will announce your name from the podium, and you may proceed by asking your question over the air. We'll start with Sam Zern at WPLN. Sam, you're on the air.
Good morning, y'all. So this is a question, obviously, about contact tracing. I'm curious as to how the contact tracing team is getting in touch with potentially essential workers and how they're handling, if somebody has to come into work. Are you calling employers beyond just, is it on the individual to communicate with their employers that they've been in contact, or is Metro calling employers for that information?
Leslie Waller.
Hi, Sam. In relation to essential workers, there are specific CDC guidelines for managing, notifying exposures in those essential workplaces, and we follow those guidelines. We do communicate directly with the place of work and work in tandem with them to identify any potential contacts there and get them into our monitoring system and go forward with the quarantine period for contacts.
Jeremy Finley, News 4. Go ahead, Jeremy.
Good morning, everybody. I have another question about the contract tracing. I was trying to get an idea of the scope of how many people at this point you are monitoring that have come in contact with someone who has tested positive. I wonder if you had a number that could give us an idea of the scope of how many people you are monitoring right now. And my second question is, at some point, how do these people get taken off a list of being, I guess, I don't know if monitored is the right word or what is, but how do you see this number dropping in terms of how many people have been in contact with people who have tested positive? Trying to get an idea of the scope of how big it is.
Leslie.
Sure. As of yesterday, we had 466 people who were being actively monitored as a contact to a case. In terms of our scope of this, as we do move towards reopening the city, we certainly foresee that number growing because with more interactions comes more contacts. So to help with that, we are looking to add additional staff and expand our program.
Julia Palazzo, WKRN.
Good morning, everyone. Thank you so much for the update. Mayor Cooper, two questions for you. Governor Lee could announce as soon as today his decision about whether or not the school districts should reopen for the rest of the year. Just wondering if you've had conversations related to this with the Metro School District. Also, I know yesterday it was mentioned people struggling to file for unemployment. Have you had that conversation with the state yet about fixing that problem for people in Davidson County? Thank you.
Mayor Cooper.
We haven't talked about school districts. That's obviously a source of concern. And then in terms of filing for unemployment, I think tomorrow's press conference is going to have more information there. As it was pointed out to me, the federal response does allow for unemployment claims even if you've not been filing a W-2. So there's an expanded unemployment claim benefit that is out there that I think is going to require some community communication in terms, and also in terms of how to get federal money. It is something the city is deeply exploring, is how it's a little bit confused, I will say at this point. A lot of regulations have not yet been written about how, in fact, to implement the CARES Act for the benefit of everybody here in Davidson County. And then back to your school district question, I think it's just on a week-by-week basis about having any insight into that. Obviously, we're getting very close to the end of the school year, and that will be a consideration for the governor, the city, and frankly for the school boards themselves who will be making that final decision.
Tosin on News 4. Go ahead.
morning. Thanks for taking my question. I have two questions. The first for Dr. Jahangir. Where do we stand on equipment and testing kits for Nashville and the assessment centers? Do they have enough to keep going, and for how long? And my second question would be for Leslie. How long does the process take of tracing back one person? And based on all this knowledge, since you're the lead, how do you feel, your thoughts on getting the economy back open as early as May? How feasible do you think that is? Thank you.
Dr. Jungir?
Thank you. Regarding our assessment centers, I feel very comfortable with the amount of personal protective equipment we have, as well as tests. As you all remember, our initial aspect on the test, we didn't have the swabs, but now we have an arrangement for essentially every swab that we send to get analyzed, we get at least a one-to-one transfer back of new swabs. So unless something changes there, we're good and on equipment. And I'll defer to Ms. Waller for the next question.
Sure. So in terms of reopening, it's certainly something that we are anxious to do just like everybody else, but we need to do it in the right way, and we are working towards achieving that. I also realized I didn't answer Jeremy's second question, and the way you get off of our monitoring list is actually part of a larger process. We actually contact our cases and contacts on a regular basis, so we're in communication with them regularly, daily. So once we have finished the time frame that they're supposed to be monitored, we release them from that isolation or that quarantine. And if someone needs a letter, we can provide that.
Harriet Wallace, Fox 17. Go ahead, Harriet.
Hello, good morning, everyone. As we start to now kind of look towards May 1st, when the city and the state right now is anticipated reopening, my question is, we have issued the orders to flatten the curve, which it sounds like we're trending towards. But come May 1st, that does not mean that the virus is gone. So are you all anticipating a spike in cases potentially after we reopen? And what will be the new life afterwards? We may reopen, but will there be some additional orders in place? And then lastly, can you all please provide an update on any Metro employees, number of those cases? Thank you so much.
Mayor Cooper.
Harriet, thanks. And then I'll ask Dr. Jahangir to answer your other question. May 1st is an aspiration. It is in no way, and frankly, in discussing with the governor yesterday, May 1st is not a restart date, so let's be clear. But at some point, we are going to restart. And part of our discussion about contact tracing today is what do we need to be good at in order to restart. I think the state, certainly the city, everybody else is exploring what does a restart look like? What capabilities do we need to have in place? That's PPE, that's testing, that's contact tracing. Also, at what level of cases do we need to be at in order to begin a gentle reintroduction back into our economic life? So I wanted to come and talk about this and make sure that people realize that there's not a commitment to restart on May the 1st. There is a commitment to restart as soon as we can when it is appropriate and safe to do it without undoing all the hard work that has been done in the last month. And that's an important thing, without undoing all the hard work that has been done in the last month. But probably we will be excited to talk about a gentle reintroduction strategy that allows us to do that going forward. So, and then here's Dr. Jahangir.
Thank you. Regarding Metro employees, they're under 10 individuals, and I have to highlight that not every Metro employee lives in Davidson County, and so there may be some individuals who have been reported to their local health facilities that have not maybe been reported in Davidson County, but there are under 10 currently that we're aware of in our system. Thank you.
Brett Kelman with the Tennessean.
Hey everyone, this is a question particularly for Dr. Pilger. I have been watching the daily growth of the virus based on numbers released by the state, and as I'm sure you've noticed, the percentage of growth in late March was significantly higher than it has been in April. I'm curious if Dr. Hildreth could speak a little bit to sort of the arc of the outbreak and how significant it is that daily growth rates have been cut to like 25% of what they were.
Thank you, Brett. Dr. Hildreth.
I think that what we all have to realize is that the hard work we've done by staying home and doing all the things we've been asked to do, objectively it seemed to be working because the rate of growth of new infections has flattened. But the truth is, without extensive testing, it's hard to answer your question definitively. But what seems to be happening is social distancing and all the other steps that we've taken as a community have had an impact on the virus. I need to remind people that there are 330 million plus people in the United States. Only 0.5% of those people have been infected, which means that the virus might be with us for a while because the level of herd immunity achieved by infecting 0.5% of the people is almost zero. And as the mayor said, we have to be guided by the science before we drop our guard and go back to a new normal, and it will be a new normal. But I think the answer to your question is the steps that we've been asked to take, and apparently we're doing those things, has flattened the curve of growth of the virus, and we don't want to undo that by dropping our guard. But I think that's what the data is showing us.
Kara Hartnett. Kara, you're on the air.
Thank you. I have a few questions for Ms. Waller. First, just following up on the number of people being monitored. Throughout the duration of the pandemic, has your team been able to keep with the number of people that need tracing?
Thank you, Kara.
Yeah, overall, our team has done a really good job of keeping up with the pace of adding new cases and contacts. I'm not going to lie, there have been a couple of days where that's been really difficult because we were a small team early on, but we have made a lot of gains in growing our staff, and fortunately, the cases per day have slowed down. So, yeah.
Our final question is from Ian Jong at the Tennessean. Ian?
Hi, good morning. I was curious to know, of those who are currently hospitalized, do we have a figure for how many are needing intensive care or have needed ventilators, and in general, that percentage for overall hospitalized cases?
Intensive care and ventilators among the overall hospitalized. Dr. Jahangir?
So what I'll tell you is I don't have a formal number for you, but as I've mentioned to you, every morning I speak with each hospital in town via whether it's text, email, or sometimes a phone call. There are still currently 50, 60 individuals who are hospitalized in our hospitals, and of those, a small percentage are ICU. But what I think the bigger question to ask here is how are our hospitals doing and able to care for our patients? And right now, I'm very comfortable to say our hospitals are doing a great job and have capacity to take care of patients who need ICU care or don't need ICU care but need hospitalization. There's a good capacity. There's good ability to take care of them. And again, this is a pure direct correlation with the planning of the hospitals, planning of the city, and all of you helping flatten the curve and not overrunning our systems. So take-home message is that we're doing fine as a city and as a region for hospitals, but the exact number is what I mentioned earlier. Thank you.
Kara Hartnett had a follow-up question. Kara?
Thank you. Again, for Ms. Waller, on the contact tracing, how do you keep record of the data? Like, is everything mapped out on a mass document? And also, do you solely get your information from patient interviews, or use other sources of data to help those, like, for example, cell phone data or bank records, things like that?
Leslie?
So we do have several databases that we use to keep track of all of our cases and contacts. One of those is a statewide database, and then the other two really kind of manage the information from our contact investigations and contact management and that follow-up process. We stick to the tried and true method of Excel and SharePoint, so we stay organized that way. And that way it's easily shareable with all of our staff. In terms of, what was that second question? Right. So we do not use cell phone data or phone records. We don't have access to that information. But we do a very thorough interview with our cases, and in some cases we certainly do have access to employment information and work information and things like that.
Thank you again to Dr. Hildreth and Leslie Waller for joining us this morning. There are no more media questions in the WebEx queue at this time. A recording of this morning's press briefing will be made available later today. Thank you everyone for joining us. This concludes today's Metro COVID-19 press briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.org.